And I'd like to invite all of us now to stay on screen. We're going to have a discussion period in this final section. I'm welcoming as well Lenny Duffield. If you could pop on, and if we could deaf sign clap her as she comes on to make us feel welcome. And Lenny is the Executive Director of Huntington's in Western Australia. So welcome to you. And could I just say to people, if there's any comment or question, pop it in the Q&A or pop it in chat. We can look at both. And the book that Rob referred to, Lewis has put the title and author in the chat. And can I just say, while your presentation was on, Rob, I'm involved in advocacy around head and neck cancer because that's something I've experienced in my life. But I have built up over a handful of years. I was just checking I've got just under 12,000 followers on Twitter that are almost exclusively to do with head and neck cancer. So what I'm trying to say is to build up and sustain a number like that when you are dealing with a rarer condition that is hard for people to think about because it's very confronting. It's a similar challenge to Huntington's, and I just want to share that. And so while everyone is speaking today, I take snapshots on my iPhone of images that offer hope and inspiration. And I'll sit down for half an hour afterwards, and I tweet and Facebook and Instagram and LinkedIn. If people aren't aware of LinkedIn, it's usually a professional social media link, but I've found because it is professional, you can get into a health network there very readily and really raise awareness. So I guess I just wanted, I won't talk after this, I'm the facilitator, but I just wanted to applaud Rob's approach that every step counts, and indeed Julie's approach as well. So in terms of questions, I guess I'm quite keen to hear a little bit more about what's happening with service provision and specialist housing in the Netherlands. But before I come to Rob, let me come to Western Australia first. Lenny, just tell us a little bit about your organisation, and were there issues that have been raised today by Lewis or Julie or Rob that gel with the sort of things you're talking about in Western Australia?
Oh, thank you, Julie. And firstly, I would like to say what an amazing experience we've had with the three speakers. Thank you, Rob and Julie and Lewis, for stepping in. I've thoroughly enjoyed the sessions. Before I start about what's happening in Western Australia, we seem so far away on the West Coast. We're a little blessed. We're like a big country town, but no, I wanted to share with you, I did take some notes through the sessions, and I guess one of the things and it stems from probably feeling like a big country town here, certainly in Perth and Western Australia. And it comes back to my points around advocacy, and I wanted to share with you, I guess, and this is what we try to do in Western Australia. It's, advocacy has the power of connecting people and communities through sharing stories. And we all share stories, and whether that is just talking about our day to our loved ones, or, ringing a friend or sending a message, we share stories. We do that as our culture, and how we interact. And so advocacy has power to share stories and experiences. And we shouldn't underestimate or realise the value of our voice, or the value of your voice, or even the value of having that voice for those who no longer have a voice, or they've chosen you to be their voice for them. Is that there is a real power to that, and to share that story and connect people. And it has the ability to bring people together and improve services, achieve justice, alter values in our community and our attitudes, and really build a confidence within the community. And so, I think what we try and do a lot of here in Western Australia is share stories, encourage people to share their story if they feel comfortable to do so, or, provide us with an avenue if they feel comfortable for us to share that story. So we're building community stories, and we're building confidence and connecting communities. So in Western Australia, where obviously I am the Executive Director of Huntington's WA, we have a small team here, and we service all of Western Australia, and we do that through digital platforms and face-to-face delivery, as well as doing country outreach. It's a big ask, but we do that. And in Western Australia, in the last 12 months, we've provided services and support to 474 unique individuals across Western Australia. So, and that goes to people who are gene positive, gene negative, at risk, family members, allied health, community organisations, NDIS providers, and the like. So we provide advocacy ourselves. So we do an advocacy service for our clients and supporters. We provide education, and we do direct service delivery ourselves. But I think talking about consumers, I think it's really, really important, you know, to not underestimate the realisation of the value of your voice. You know, and if you don't feel confident to do so, then reach out to others who will be willing to support you to do that. And certainly I know my counterparts in the other states are certainly, their organisations and their wonderful staff there certainly would be more than willing to provide that support to you should you need it.
Look, thank you. I might come to Julie Burgess now, if I may. Julie, as I watched Rob's presentation, I had a sense of his growing, you know, reaching out as he did in his cycle beyond his individual circumstances much more broadly, and that this gave him a sense of hope and engagement. You could fit the spirit that is released when people come together. Anyone who quotes Corinthians that often knows what I'm talking about. But do you ever gather together with other carers or other family members affected by Huntington's, or has it more been a solo journey for you caring for your daughter?
Yeah, look, Christy's it came through, Huntington's came through her father's side of the family. So I have very strong connections with my couple of nieces in New South Wales. So they've been fantastic. Yeah, good question.
I guess, you know, part of what we're talking about here is the potential to become active as a national network, and in a state-based environment as well, but to band with others to achieve results. And perhaps I could ask you this: what would help you as someone advocating in such a consistent way for your daughter? Is there something that would help you do that?
You asked a question too. We had a group here in Tasmania, the Huntington's Association, Pam, put it together, which was wonderful. And so we'd get together by phone. And I think that helps because they're sharing their story as well. You don't feel, because you can feel very isolated. I also had my brother-in-law. We connect quite a lot because of both having, you know, we married the siblings. And so that's been a wonderful part of it as well. Yes. Sorry, I'm not.
No, that's okay. I'm
a bit brain dead. I do beg your pardon.
That's all right. You did an absolutely wonderful presentation. I'm going to ask you a really difficult question. I hope you don't mind, but do you have other family members or friends that you're engaging with to support your daughter at a time when you may not be available to do so? You know, the concern of every parent whose child has a difficulty of what will happen when I'm not around. Do you have plans in that regard?
Yeah, look, my brother-in-law is amazing. His wife has passed away from Huntington's. They have no children, and he's my backstop. My mum's 80. So it's really quite interesting because even it's more on my husband's side of the family. They get it. Do you know what I mean? It's hard to put that into words sometimes because they've seen it for many, many years and generational. So they're the support, whereas my sister's much younger and they don't quite have that same level. You know, before it maybe just been behavioural issues going on, and you know, you may be pampering that member of the family. Do you know what I mean? They didn't quite get the essence of Huntington's disease. So, yeah, I think education's a very big thing. And
I'd say, Julie, as someone listening to you, your sensitivity around the nuances of being vulnerable to carers, I thought was absolutely very deeply moving. And that notion of ownership of space and the transition from the hospital to the house and it becoming Christie's house. When it comes to advocacy, and I'll come to Rob now, if I may, for a moment, that power of storytelling, like I had an overwhelming desire to get Julie and take her to the Minister for Health in Canberra, which is our capital city, and just explain, just to get her to tell her story, is the emphasis here. Tell us a little bit about the role of the story in advocacy, because you've obviously taken to a little bit of self-revelation, which I gather is a powerful thing with Huntington's disease because of the stigma.
Yeah, no, definitely. And I think I think Julie would be a very good person to take to Canberra and to tell her story, because in the end, it is about, people cannot imagine how it is to have a Huntington patient as a family member or to take care of them. I mean, it is unimaginable unless you have lived it. And I'm not being overly dramatic here, it's just reality. So every time, this is the good, like in the HD Cope, that's why I said we have so many family members there. It is really nice because I will tell the story of my mom and what happened to her and how she would respond to things. And maybe Julie would be there and tell how her daughter would respond to things. That might be the same, it might be different, but it gives you the total breadth of the experiences. And that makes it extremely powerful. You always tell from your heart your own story, don't generalize, because there is no general HD patient. There is just you and your family, I think.
I have the impression, and I'll come to Lewis in a moment, that there are many people affected by Huntington's in Australia who are at the very beginning of advocacy beyond the home, simply because of the enormous amount of time involved in supporting a family member. And I felt one key message from your presentation, Rob, was just begin as you can wherever you are. The second message I got is that there's power in coming together and meeting others and a certain comfort. Could you just give us a sense of the 3 or 4 key issues that come up across Europe that you've noticed, that whatever nation you're in, there are some issues in terms of what do we want, the question that Lewis posed?
I think, what people want, or no, what people are looking for, I'm not sure if they know they want it, but often what people long for is just recognition, companionship, or how you want to call it. Just, when I went to the EHA meeting the first time, I didn't know what I was looking for. I just wanted to go. I met, the pivotal moment for me was, I was like the first coffee break, I just went random, sit at the table, and a girl came sitting next to me, said, "Can I join you?" And I was like, okay. And we started talking, same age, mother, same age, both in the same stage of Huntington. We didn't need words to explain. Then a third person joined, same age, same mother age, gene carrier. And we were just high-fiving at the end of the coffee break about how miserable our lives at some point must have been, It sounds really weird if you talk about it like that, but it was so empowering to meet people that know exactly, without having to say what they know exactly what you've been through. So recognition, that's one. And I think that is the main thing. Of course, we are always looking for, better care, and we always look for cure and those kind of things. But I think deep down, we just need recognition.
Gee, I'm enjoying meeting you all. It's fantastic. Lewis Kaplan, what are you hoping will come? Because I've had a sense from you throughout this conference that you're hoping for more united action across Australia. So what do you want to share with us, some of your hopes of what we'll do in Australia over the next few years?
Yes, thanks, Julie. I, having worked in numerous community organisations, have felt really challenged by the fact that the Huntington's community hasn't wanted to put its head up and be counted, hasn't wanted to bang the table and argue systemically for change. Or if they have, they haven't done it terribly effectively, partly because of the small numbers, but I think mainly because of the stigma and the huge burden and stress of caring for people with Huntington's, and the sense that if you're next generation, you're looking down the barrel of your parent deteriorating, well, that's where you're going to be in a few years' time. So it's a very, very tough space to be. So I think a couple of things. First is that the young people today, I had hoped, would be more likely to engage and feel less stigmatized and want to connect with each other. there's an international group called Huntington's Disease Youth Organization, HDYO, which is very effective, but it's international. So we've tried in both in New South Wales and in Western Australia, and to an extent in Queensland, to make the youth program operate so that local young people can engage with each other. We've been running that program now for three or 4 years, and it's starting to get some momentum. But even with that group of young people, there's very few who are prepared to stand up and be counted, to kind of go public with their Huntington's disease, come with me to talk to a politician about their situation and how their lives have been affected. Now, interestingly, because they're young, they're not sick, they're not disabled, there's no funding for them. They're not going to get any funding out of the health system or the disability system, possibly the mental health system, but it's got other priorities. So the associations have actually ended up looking for supporting this program from its own resources, because we fundamentally believe that if we can help the next generation of people who are at risk of Huntington's disease become resilient and become able to, I guess, sustain their own well-being, their own mental health, we will have made an important contribution. The other area, as we've discussed in the previous sessions, was getting younger people who are currently locked up in residential aged care out and into much more appropriate disability accommodation. To me, that's a big deliverable. And if we can demonstrate to the community that we can make that happen, I believe the community will then get a sense that we can make a difference, we can make things change, and are more likely then to pick up other ideas and run with them once we've achieved that one.
Thank you so much, Lewis. Lenny, can I come back to you in Western Australia? You're someone obviously involved with lots of families. What would you like to see happen in the next couple of years along the, you've heard what Lewis has said. I mean, people like you and Lewis are going to be catalysts, aren't they, to bringing people together?
Thanks, Julie. Look, probably I would like to see, probably first and foremost, our communities, collective communities across Australia, feeling like they do have a voice. And I think part of it does come from stigma, but I think part of it is they are so involved within their families and within the disease that it almost seems too hard to take on, another project or do another thing or have another ask. And, can I do any more? Can I give any more? And sometimes that feels really hard. And sometimes, and I think, Rob, you said it so well, sometimes it's just about starting somewhere. So I'd actually like to see our communities probably get a little more active and ask us as associations how we can support them doing that. What support they need to do that, and how can we help them doing that work? Because we shouldn't assume that, okay, they need this and we'll provide this. We really need to know what is of value for them, and then how we can provide that value, how we can provide that support, and then I think we will see change. Lewis has said it as well. I think that there's a lot of work to do in the residential care space, and and I think we need to also make sure, and Julie picked up on it, it's what people identify as being home to them. And so some people will feel that home is in a residential care setting. Some people will feel that home is their family home. Some people will choose that, it's about enabling to have that choice of where that home is, and then really advocating to come back to go, what does the best possible care look like? And I would actually like to see us in Australia really getting a clear indication of what the best possible care looks like to be provided to anyone impacted. And so we're not only talking about those who have the disease, but their families need caring for, their communities need caring for. We need to have a community approach when we're caring and providing care to these individuals. And I think if we can get these ecosystems of care happening, because in Australia we're so large, we're so vast, and You know, to have someone here in Western Australia in the Arnhem Lands, which, you know, you'd have to fly to Broome, and most people know Broome and Cable Beach. And then it's about a 2,700 kilometre drive one way out to the Arnhem Lands. There's no flights unless you're with the Royal Flying Doctors, or unless you charter a private one, which is quite astronomical in pricing. So it's very unrealistic to expect to get a quality of care and someone there. But what does it look like, and how can we duplicate that care in that community and provide that to the whole community so they can sustain that family, 2 families, or so I'm interested about making sure that, and it links into, I guess, residential
I'm going to
care.
have to
And what,
come in. I'm sorry,
Yeah.
Lenny. I hate to interrupt you because I'm enjoying so much the important things that you're saying, but I have the job of finishing us on time. Look, I just want to thank everybody. We're going to ask you to do a very quick survey online in a moment. Rob, do you want to just say farewell? Because you're from Amsterdam and you've got up very early in the morning, and I think you've emphasised the wonderful positive feelings when you get together with other people, which is where all advocacy begins. So I just want to, I guess, did you want to say just one final word to your Aussie viewers before I finish up? If you pop your mic on.
Now you put me a bit on the spot because now it should be very inspirational and so on.
Not at all. We just
No, but
so
I think,
grateful for you
you know,
coming.
you know, for me, it's just this, well, I can maybe in a short reply to what Lenny has been saying. So for example, in Europe, we are working now on a big European project on remote care. So using digital technology to provide care in remote areas. And you would think in Europe, we don't have remote areas, at least not compared to Australia. But definitely there are people, of course, living on the islands somewhere north of Scotland, and they can't get to proper care either. So this is, I think we see digital technology, especially in care, and you know, very important, I think, especially in remote areas. So I think there's the way to go. That is good. And I just want to thank you again. Just that you know, it's nice to be part of this discussion and be able to talk for the Australians. And I hope to meet you one day in person again for some, and for the first time anytime soon after that.
And give our love to your wife who's shared you with us for this morning. We really agree. Look, ladies and gentlemen, I want to thank our panel. I want to thank you, our audience. Really want to thank Lewis Kaplan, because I think getting together international speakers and seeing other residential care in Denmark that was so, you know, progressive, and you can imagine living there, was tremendously important. I want to thank Roche, the sponsor, and also the Australian government for their support, and our exhibition sponsor, Novacor, who makes special beds and chairs for people with Huntington's, who just were fantastic on our first webinar. And I think I want to thank you for having me as your host for these 4 sessions. It's been absolutely tremendous. And I will tweet and social media my heart out, I promise, when I get off, and reach thousands of people in the international health sector. And I would ask you to do your deaf sign clapping to everyone for being here. And I'd ask you to stay on, because Lewis is going to put up just a 4-question survey, and we'd be so grateful if you'd fill it in. And I look forward to seeing you all another time. So stay on. And Lewis, do you want to pop up the survey, please? Thank you.